Are you curious about the uses, dosage instructions, side effects, and user feedback of prochlorperazine? In this video, we will delve into the common indications of prochlorperazine, the recommended dosage instructions, potential side effects to be aware of, and real user feedback to give you a comprehensive understanding of this medication. Prochlorperazine is a medication that is commonly prescribed to treat various conditions such as nausea, vomiting, and certain mental health disorders. By understanding the common indications for which this medication is prescribed, you can gain insight into its potential benefits for your health. Additionally, it is essential to have a clear understanding of the correct dosage instructions to ensure you are taking the medication safely and effectively. We will provide you with the recommended dosage guidelines to help you use prochlorperazine properly. Moreover, like any medication, prochlorperazine may also have potential side effects. By being aware of these possible side effects, you can make informed decisions about whether this medication is right for you. Lastly, we will share real user feedback to give you a glimpse into the experiences of those who have used prochlorperazine. This first-hand insight can help you better understand the effectiveness and potential drawbacks of this medication. Stay tuned for an in-depth exploration of prochlorperazine's uses, dosage instructions, side effects, and user feedback. What is prochlorperazine? Prochlorperazine is a medication that belongs to the class of drugs known as phenothiazines. It is commonly prescribed to treat a variety of conditions, including nausea, vomiting, and certain mental health disorders. This medication works by affecting certain chemicals in the brain, helping to alleviate symptoms associated with these conditions. Prochlorperazine is available under various brand names, including Compazine and Bucostem. It can be taken in different forms, such as tablets, injections, and suppositories, depending on the specific indication and preference of the prescribing healthcare professional. It is important to note that prochlorperazine should only be taken under the guidance and prescription of a healthcare professional. Let's explore the common indications for which this medication is prescribed. Common indications for prochlorperazine: nausea and vomiting. One of the primary uses of prochlorperazine is in the treatment of nausea and vomiting. It is particularly effective in managing these symptoms associated with chemotherapy, radiation therapy, and surgery. Prochlorperazine works by blocking dopamine receptors in the brain, which helps to reduce feelings of nausea and the urge to vomit. Mental health disorders. Prochlorperazine is also prescribed to manage certain mental health disorders, such as schizophrenia and severe anxiety. It helps to regulate imbalances in certain brain chemicals, such as dopamine and serotonin, which are associated with these conditions. By doing so, it can help alleviate symptoms such as hallucinations, delusions, and agitation. Vertigo. Prochlorperazine is sometimes used to treat vertigo, a condition characterized by a spinning sensation or dizziness. It works by affecting the inner ear, which plays a role in maintaining balance. By reducing the symptoms of vertigo, prochlorperazine can improve the quality of life for individuals affected by this condition. Migraine. In some cases, prochlorperazine may be prescribed to manage migraines. It is believed to work by reducing the sensitivity of certain brain structures to pain signals. Additionally, prochlorperazine has a sedative effect, which can help individuals find relief from the debilitating symptoms of migraines and improve their overall well-being. Now that we have explored the common indications for prochlorperazine, let's move on to understanding the recommended dosage instructions. Dosage instructions for prochlorperazine. The dosage of prochlorperazine may vary depending on the specific indication being treated, the severity of the condition, and individual factors such as age, weight, and overall health. It is crucial to follow the instructions provided by your healthcare professional and to never exceed the recommended dosage. Nausea and vomiting. For the treatment of nausea and vomiting, the typical starting dose of prochlorperazine is 5-10 mg taken orally every 6-8 hours. The maximum daily dose should not exceed 40 mg. In some cases, a lower dosage may be prescribed, especially for older adults or individuals with certain medical conditions. Mental health disorders. When used to manage mental health disorders, the dosage of prochlorperazine may vary depending on the specific condition being treated. For schizophrenia, the recommended starting dose is usually 10 mg taken orally 3-4 times a day. The dosage may be adjusted based on the individual's response to the medication. Vertigo. The recommended dosage for vertigo is typically 5-10 mg taken orally 3-4 times a day. This can help alleviate the symptoms associated with vertigo and improve balance. Migraine. Prochlorperazine is usually prescribed in a dosage of 5-10 milligrams taken orally every 6-8 hours as needed for migraine relief. It is important to note that prochlorperazine should not be used as a preventive treatment for migraines, but rather as a medication to alleviate acute symptoms. It is important to take prochlorperazine as directed and to not abruptly stop taking the medication without consulting your healthcare professional. Abruptly discontinuing prochlorperazine may cause withdrawal symptoms or a reoccurrence of symptoms. If you have any concerns about the dosage instructions or need further clarification, always consult your healthcare professional. Now that we have covered the dosage instructions, let's discuss the potential side effects of prochlorperazine. Potential side effects of prochlorperazine. Like any medication, prochlorperazine may cause certain side effects. It is important to be aware of these potential side effects and to discuss them with your healthcare professional before starting the medication. It is worth noting that not everyone experiences side effects, and the severity and frequency of side effects may vary among individuals. Common side effects. Some common side effects of prochlorperazine include drowsiness, dizziness, dry mouth, blurred vision, constipation, and urinary retention. These side effects are usually mild and often subside as the body adjusts to the medication. It is recommended to avoid driving or operating machinery until you know how prochlorperazine affects you, as it may impair your ability to perform certain tasks. Extrapyramidal symptoms. Prochlorperazine, like other medications in its class, can cause extrapyramidal symptoms, which are movement disorders that can range from mild to severe. These symptoms may include muscle stiffness, tremors, restlessness, and involuntary movements. If you experience any of these symptoms, it is important to contact your healthcare professional for further evaluation and guidance. Tardive dyskinesia. In rare cases, long-term use of prochlorperazine may lead to tardive dyskinesia, a condition characterized by uncontrollable movements of the face, tongue, and other parts of the body. Tardive dyskinesia may be irreversible, so it is essential to report any unusual or involuntary movements to your healthcare professional promptly. Allergic reactions. Although rare, some individuals may experience allergic reactions to prochlorperazine. Signs of an allergic reaction may include rash, itching, swelling, severe dizziness, and difficulty breathing. If you develop any of these symptoms, seek immediate medical attention. It is important to discuss any concerns or potential side effects with your healthcare professional. They can provide you with personalized guidance and monitor your response to the medication. Now, let's move on to hearing what real users have to say about their experiences with prochlorperazine. User feedback on prochlorperazine. Real user feedback can provide valuable insights into the effectiveness and potential drawbacks of prochlorperazine. It is important to note that individual experiences may vary, and what works for one person may not work the same way for another. Here are some snippets of user feedback on prochlorperazine. Emily: I have been taking prochlorperazine for my severe nausea during chemotherapy, and it has been a lifesaver. It helps me get through my treatment sessions without feeling constantly sick. The only downside is that it makes me a bit drowsy, but it's a small price to pay for the relief it provides. Mark: I was prescribed prochlorperazine for my vertigo, and it has made a noticeable difference in my daily life. The spinning sensation has significantly reduced, and I feel more balanced. The only side effect I experienced was dry mouth, but it's manageable. Sarah: prochlorperazine was prescribed to me for my severe anxiety, and it has helped calm my mind and reduce my panic attacks. However, I did experience some extrapyramidal symptoms initially, which were quite uncomfortable. Thankfully, they subsided after a few weeks. John: I suffer from migraines, and prochlorperazine has been a game changer for me. It helps alleviate the pain and nausea associated with my migraines. The only downside is that it makes me feel very drowsy, so I have to plan my day accordingly. These testimonials highlight the varying experiences individuals have had with prochlorperazine. It is important to remember that everyone's response to medication can differ, and it is crucial to consult with a healthcare professional to determine the most suitable treatment approach for your specific needs. Now, let's compare prochlorperazine to other medications commonly used for similar indications. Prochlorperazine versus other medications for similar indications. Prochlorperazine is not the only medication available for the treatment of nausea, vomiting, mental health disorders, vertigo, or migraines. There are other medications commonly used for similar indications, and the choice of medication depends on various factors, including the specific condition being treated, individual response, and potential contraindications. Here are some alternative medications that may be prescribed. Ondansetron. Ondansetron is another medication commonly used for the treatment of nausea and vomiting. It works by blocking certain receptors in the gut and the brain, helping to reduce the urge to vomit. Ondansetron is often prescribed for individuals undergoing chemotherapy or surgery. It is available in oral and intravenous forms. Diazepam. Diazepam is a medication commonly used for the treatment of anxiety and muscle spasms. It belongs to the class of drugs known as benzodiazepines and works by enhancing the effects of a neurotransmitter called GABA in the brain. Diazepam may be prescribed for individuals with severe anxiety or panic disorders. Meclizine. Meclizine is an antihistamine medication commonly used for the treatment of vertigo and motion sickness. It works by blocking certain receptors in the inner ear, reducing dizziness and the spinning sensation associated with vertigo. Meclizine is available in oral form and is often taken as needed. Sumatriptan. Sumatriptan is a medication commonly used for the treatment of migraines. It belongs to the class of drugs known as triptans and works by narrowing blood vessels in the brain and reducing inflammation. Sumatriptan is available in oral, nasal spray, and injectable forms. It is important to discuss the pros and cons of different medications with your healthcare professional to determine the most appropriate treatment option for your specific needs. They can consider your medical history, potential drug interactions, and individual response to the medication. Now, let's discuss some precautions and contraindications associated with prochlorperazine. Precautions and contraindications for prochlorperazine. Prochlorperazine may not be suitable for everyone, and there are certain precautions and contraindications to be aware of. It is important to discuss your medical history and any existing conditions with your healthcare professional before starting prochlorperazine. Here are some precautions and contraindications associated with prochlorperazine. Allergies. If you have a known allergy to prochlorperazine or any other phenothiazine medications, it is important to inform your healthcare professional. Allergic reactions can be severe and may require immediate medical attention. Parkinson's disease. Prochlorperazine may worsen the symptoms of Parkinson's disease, a neurodegenerative disorder that affects movement. If you have Parkinson's disease or a history of it, it is crucial to discuss this with your healthcare professional before starting prochlorperazine. Blood disorders. Prochlorperazine may affect blood cell production and can potentially worsen certain blood disorders. Individuals with a history of blood disorders should be cautious and discuss their condition with their healthcare professional before taking prochlorperazine. Pregnancy and breastfeeding. The use of prochlorperazine during pregnancy and breastfeeding should be discussed with a healthcare professional. Prochlorperazine may pass into breast milk and can potentially harm a nursing baby. Glaucoma. Prochlorperazine can increase the pressure within the eye, which can be dangerous for individuals with glaucoma. It is essential to inform your healthcare professional if you have glaucoma or any eye conditions before starting prochlorperazine. It is important to note that this is not an exhaustive list of precautions and contraindications. Always consult with your healthcare professional for personalized guidance based on your specific medical history and needs. Now, let's explore some alternative treatments for the indications of prochlorperazine. Alternative treatments for the indications of prochlorperazine. While prochlorperazine may be an effective treatment for certain conditions, there are alternative treatments available for the indications it is commonly prescribed for. It is important to discuss these alternatives with your healthcare professional to determine the most suitable treatment plan for your specific needs. Here are some alternative treatments for the indications of prochlorperazine. Nausea and vomiting. For mild cases of nausea and vomiting, lifestyle changes such as eating smaller, more frequent meals, avoiding trigger foods, and staying hydrated may be sufficient. Ginger, both in the form of supplements and ginger-infused drinks, has also shown promise in reducing nausea. In severe cases, other medications such as ondansetron or metoclopramide may be prescribed. Mental health disorders. In addition to medication, therapy and counseling can be valuable in managing mental health disorders. Cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and other evidence-based therapies can help individuals develop coping mechanisms, manage symptoms, and improve overall well-being. In some cases, other medications such as selective serotonin reuptake inhibitors, SSRIs, or atypical antipsychotics may be prescribed. Vertigo. Depending on the underlying cause of vertigo, treatment approaches may vary. Physical therapy exercises, such as the Epley maneuver, can help reposition displaced crystals in the inner ear, alleviating symptoms. Vestibular rehabilitation therapy and balance retraining exercises may also be prescribed to improve balance and reduce dizziness. In some cases, medications such as meclizine or beta-histine may be prescribed. Migraine. Migraine prevention strategies may include lifestyle modifications, such as identifying and avoiding trigger factors, regular exercise, stress management techniques, and adequate sleep. For acute migraine attacks, over-the-counter pain relievers such as ibuprofen or naproxen sodium may be effective for some individuals. Triptans, such as sumatriptan, are often prescribed for more severe migraines. It is important to work closely with your healthcare professional to determine the most appropriate treatment plan for your specific needs.